Dr. James Hawley of Southeast Texas Medical Associates joining us now. And Dr. Hawley, in our Healthy Living segments, we've talked about the patient's baton, how important it is taking control of your fitness, and then we talked about medical home last week. How is all of that, and I guess measuring it in between, how does that all go into each other?
Well, it really is that the patient is the center focus. It's no longer procedures and tests, and it's no longer the business of medicine, but the patient is returned to where the patient's always been, and that's the center of the healthcare equation. And it really is about coordination of care. Healthcare is complex today, and people can get confused. It's coordination of where they're going to go, when they're going to go, how they're going to get there. All of that becomes part of the healthcare delivery process.
And in the coordinated care, that can be so confusing, as you mentioned, you know, with patients. But what does that mean when you're able to, I guess, coordinate it, make sure it's all lined up?
Well, an illustration is when a patient leaves the hospital. There are a number of very complicated events that take place, one of which is medications. Most hospital readmissions that are preventable occur because of medication errors. You have to decide what medications the patient is going to be on. Are they going to continue the medications they were on before? If they're not going to be on the same medications, can you give the patient a printed, legible copy of the medicines they're supposed to take, of the medicine they're not supposed to take, make sure they're going to get those medications, and then follow up to make sure that they didn't have any problems with the medication, they were able to obtain the medications, because you can prescribe the best treatment in the world. If the patient can't access it because they don't have the funds or they don't have the transportation, they don't have access to it, then you're not going to help them.
And speaking of helping them, and this can happen a lot, I'm sure, how can you help, and you know, the doctors at SETMA, when you leave the doctor's office, or I guess, you know, a hospital visit, going to the pharmacy, and if, you know, the day-to-day person doesn't know medicine, and the pharmacist says, well, we can't do this because that, then, and it's happened to me, and I don't understand what you're saying. The
wonderful thing about electronics, and we've been using electronic records since 1998, is that we now can do what's called e-prescribing, electronic prescribing. We do this because I can't write legibly, you know, and the embarrassing thing is sometimes I can't read my own writing.
That's okay.
And so often you would write a prescription, give it to the patient, they take it to the pharmacist. The pharmacist, I can't read it. They call back, well, pull the chart, and you're days getting the medication. Now, in the examination room, the patient tells us where their pharmacy is. We put that pharmacy in their database. We click a button, and the medication goes directly to the pharmacist. It's legible. We get immediately a note back saying the patient medication got there. They don't have to make a trip to present the prescription. It's legible, and then they can show up and get their prescription. It's much, much easier. We have a record of that, the whole transaction, the loop. The patient comes in, it's assessed, diagnosed, prescribed, and that's all done before the patient leaves the hospital. It leaves the examination room, which really makes healthcare safe and secure. Medication errors are a huge problem due to illegibility, inaccuracy, and so we have interactions, and all these things are checked electronically. There's one thing about medication interactions, and there are 15 principles about how to avoid them. The first one is don't depend upon your own memory. There are thousands, hundreds of thousands of medication interactions. And so we have a database that checks all those, and that database is much smarter than I am.
And that makes it's the checks and balances too, and you can always make sure that you're actually getting what you're supposed to.
And the patient is safe and gets proper treatment and gets it when they need it at the point of care.
Great. That is a lot of help. We appreciate that. Thank you, Dr. Hawley. Very important, and we'll have this on our website as well, all the information, and of course on SETMA's website too, because you try to make sure you get all of that in order.
Absolutely.
Thank you.
Thank you very much.
We appreciate it. You're welcome.